Hi, my name is Kara Good. I'm the director of the Respiratory Therapy Department here at Labette Community College.
Hello, my name is Ross Harper and I am with the Respiratory Therapy Department.
One of the first things we get asked is, what is a day in the life of a respiratory therapist like? And to answer that, there is no certain day in the life of a respiratory therapist. It's always different.
You could start out and you work in the ER, you go to help deliver a baby, you work in the ICU. There's many different things that can happen in a 12-hour shift.
You could be doing anything from breathing exercises with patients. You could be checking for disease process. You could be working with neonates. So it really depends on what your specialty is, where you work, and really what you want to be.
A normal shift for a respiratory therapist, there can be a couple different things. For me, is working in a home health setting. It's usually 8:30 to 5. You do have to be on call some weekends. On the other side of that, you could work in the hospital. Usually it's going to be a 12-hour shift. You're working 3 days, usually a week, so it is nice that you have some days off. Respiratory is not necessarily just working in the hospital or working for home health. With respiratory, it can open the doors to many different paths.
After graduating from LCC with your associate's degree, you can go on to get your bachelor's degree. Those with a BS degree can move up the ladder a little bit faster. They might be clinical specialists, managers, that type of thing. If you're going to start in the Southeast Kansas area as a respiratory therapist, you'll probably make around $38,000 to $42,000 a year. If you live in a larger area, of course, you'll make more. That's pretty much the average for the 4-state area.
Some types of skills or things that you need to be in the respiratory field. You are working with people, so you want to make sure that you have those good people skills, that you're sincere to the ones that you're taking care of their loved ones.
We work with people with asthma, COPD, cystic fibrosis, all types of lung diseases that are chronic, and you're going to be in these people's lives. You need to be a real cheerleader, and you need to have empathy so that you can understand what they're going through. If you want to really see what program you want to go into, I would suggest going on a job shadow, but maybe not just one job shadow. Go to different areas. For me, I went into respiratory therapy, like I said, because the money was good and I knew somebody that was in it. So check your resources. Find people who are in that position, what they like and what they don't like. After working in respiratory therapy, one of the biggest things that I appreciated was the patient feedback. For example, one time a dad came in after I was working with his baby who was born prematurely and was having a hard time breathing. And we got the baby stabilized. The dad came in and said, "I want you to name this baby." And that's a pretty awesome feeling, knowing that you're so important to that family. I always wanted a job where I could help people. However, I didn't want to do nursing for different reasons, such as I wanted to work belly button up, to be specific. But this is a job where I can help people. I know I can go to bed at night knowing that I made a difference in somebody's life. It's just the day-to-day knowing that you helped people, whether it's a heart attack or a stroke victim, a premature baby. Knowing that you made a difference in somebody's life is worth everything.